Welcome to our Global Health Report number 3, Olympics Countdown, Day 15. We will be presenting regular accounts of the impact of pandemic COVID-19 upon the world generally and upon the Tokyo Olympics specifically, even as new COVID-19 cases in Tokyo near 1,000 a day in a rapid and steady worrisome trend.
Please see our previous Global Health Reports, number 1 and 2, Day 29 and Day 26, that can be found at the URL listed on this frame. Additionally, you may go to our YouTube channel entitled Global Health Report. We present our intimate knowledge of Japanese culture and the global public health threat presented by COVID-19. This QR code may be more convenient to you.
Welcome to our Global Health Report number 3, Olympics Countdown, Day 15. We will be presenting regular accounts of the impact of pandemic COVID-19 upon the world generally and upon the Tokyo Olympics specifically, even as new COVID-19 cases in Tokyo near 1,000 a day in a rapid and steady worrisome trend.
The WHO has stated that the Delta variant has been confirmed in over 100 countries. The California Department of Health has reported 630 cases of the Delta variant. This dramatic table shows that the Delta variant has risen from 0% in March 2021 to an alarming 35% of variants by June 21, 2021, as posted by the California health officials. According to CNN, more than 80 teens and adult staffers from a central Illinois summer camp tested positive for COVID-19 in an outbreak that has impacted people across 3 states. The camp held in mid-June did not check vaccination status for campers or staffers, and masks were not required indoors at the camp, according to CNN. According to The Independent, on July 6, 2021, more than 125 campers at a student ministry camp in Texas have been infected with COVID-19. Leaders sent a message to its members over the 4th of July holiday weekend, informing them of an outbreak of the coronavirus during the recent camping trip. More than 450 people attended the 4-day youth camping trip. Many of those at the camp were children in school grades 6 through 12, aged between 11 and 18. In addition to the 125 confirmed cases of COVID, hundreds more were exposed to the virus, according to the message from the church. Hundreds of others were likely exposed when infected people returned home from the retreat in June, according to The Independent. On July 4th, Americans celebrated Independence Day during a pandemic. Many without masks, following CDC relaxed guidelines, even as WHO warned that mask use continuation is advisable. Many factors continue to pose uncertainty. Vaccine effectiveness against variants and chronic disease, so-called long COVID, and equivocal disease transmission pathways. We will be discussing the latter in future global health reports. According to Sky Sports, Scotland fans watching Euro 2020 were linked to nearly 2,000 COVID-19 cases. Of the 1,991 cases registered by Public Health Scotland, 2/3 said they had traveled to London to watch England versus Scotland on June 18. A total of 397 of these fans were at the game at Wembley Stadium. Nearly 2,000 COVID-19 cases in Scotland have been linked to football fans watching Euro 2020 fixtures. Of the 1,991 cases registered by Public Health Scotland, 2/3 said they had traveled to London to watch England versus Scotland on June 18, according to Sky Sports. On July 3rd, Reuters reported the Euro 2020 soccer tournament was blamed for a surge in coronavirus cases as fans flocked to stadiums, bars, and spectator zones across Europe to watch the action while the pandemic still raged. Germany's interior minister called European soccer's governing body utterly irresponsible for allowing big crowds at the tournament. WHO said the mixing of crowds in Euro 2020 host cities, travel, and easing of social restrictions had driven up the number of new cases by 10%. A 10-week decline in new infections across Europe had come to an end, and a new wave is inevitable if football fans and others drop their guard. It was previously decided that spectators from nations other than Japan would be restricted from Olympics attendance. Will this decision be reevaluated should COVID-19 cases continue to increase, as we will discuss in this Global Health Report? Variants, especially the Delta variant, continues to menace the world and may be particularly threatening to Japan, that already has a relatively low vaccination rate among its people. What would increasing COVID-19 cases mean to the Japanese people? What would increasing COVID-19 cases mean to the Olympic athletes? According to Yahoo Sports, the Samoan government says 3 home-based members of the Samoa Olympic weightlifting team will not be allowed to compete in Tokyo due to COVID-19 concerns in Japan. The Minister of Communications said in a statement that the nation's cabinet had decided to withdraw Samoa-based members of the team because of Japan's high infection rates. According to Yahoo Sports, one of the Serbian teams tested positive upon arrival at Haneda Airport at the Olympic testing camp. Of the 5 Serbian national teams who arrived at Haneda Airport on the 3rd for the Tokyo Olympics, one player in his 30s was confirmed to be positive for the new coronavirus by an antigen test at the airport on the 4th. According to the Ministry of Health, Labor and Welfare, positive athletes have moved to medical facilities. The remaining 4 were moved to a waiting facility near the airport because of possible close contact, according to Yahoo Sports. I mentioned earlier that epicharts are appearing near vertical in some nations presently, meaning that cases are rising sharply. As a nation, the U.S. became comfortable with the saying, "flatten the curve." Watching Japan carefully as the Olympics approach shortly, this graph gives us pause. Notice the sharp increase in cases demonstrated by the red arrow. What will Japan do if cases increase from here? This graph is not as complicated as it looks. Predictions of new COVID-19 cases through the 2nd and 4th weeks of July are based upon normal crowd flows with estimated Japanese crowd flows with additional social activity due to the Olympics taking place. The red arrow points to the scenario of no increase in normal crowd activity flows with an estimated Japanese crowd flow plus an additional 5% social activity due to the Olympics. As you can see, this scenario results in more than 2,000 new COVID-19 cases by mid to late August. The declaration of an emergency. This graph becomes a little more complicated because it reflects the imposition of an emergency declaration installed to prevent potential dramatic rising of new COVID-19 cases as demonstrated in the previous graph that was based upon crowd densities. If declared early enough, and this graph shows at a density of approximately 1,000 new COVID-19 cases, as you can see, the emergency declaration and the prevention and control systems that it will require may result in the rapid fall of new COVID-19 cases through late July and August.
Thank you for watching our Public Health Report, Countdown to the Tokyo Olympics. Please subscribe to our channel. We will be publishing a new Public Health Report in several days as we edge closer to the Tokyo Olympics. Thank you for watching our Public Health Report, Countdown to the Tokyo Olympics. Please subscribe to our channel. We will be publishing a new Public Health Report in several days as we edge closer to the Tokyo Olympics. This has been a All One Health Systems LLC and Institute of Wellness LLC joint production. Please access our previous public health reports for a continuous analysis of the pandemic COVID-19 global situation and the Tokyo Olympics COVID-19 situation.